Right. Good morning, good afternoon, and good evening, wherever you are. And welcome to this exciting session on service delivery models. My name is Jorge Alvarez Sala, and I am the acting senior advisor for water and climate resilient WASH at UNICEF headquarters. I'm glad to briefly introduce you to this session, and I appreciate your time to join. I'm confident that it will meet your expectations. The session presents and discusses about existing tools and approaches that are aimed at supporting the design and implementation of new service delivery models, or the adjustment or scaling up of existing ones. By showcasing a number of case studies, the session seeks to foster a discussion between sector experts and participants among key challenges in the implementation of service delivery models and how existing tools and approaches can help address these implementation gaps. Today, we will focus the discussion on three topics. The first one, we need to focus on both the national level, the environment, and the local level, for instance, the district level, which often receives little attention. The second topic is how to support different solutions at the same time in a given moment, and how to strengthen collaboration among different actors managing different service delivery modalities. And the third topic on what elements need to be considered when scaling up a service delivery model. Today's session is also a continuation of a process that UNICEF and SIWI initiated almost 5 years ago to document some service delivery models in West Africa. And after that first approach, we realized that we needed a framework, but then a framework without action would be just a theoretical exercise. And for that reason, we are engaging a number of stakeholders, some of them joining us today, to develop a more practical tool to identify service delivery models, but also to define actions to improve the sustainability and functioning of those service delivery models. Today's session is also a continuation of a webinar that the Rural Water Supply Network organized at the end of June this year, in which some service delivery models on rural water supply were presented. Some of you might have attended that session, which is available on Vimeo if you are interested. But it's not a repetition of that webinar. Today's is not a repetition of that webinar. We hope to build up from the discussions during that webinar and to continue the discussion with some exciting case studies and also with a roundtable discussion. Of course, we don't expect that you just listen in your offices or homes. We would like to engage you in this discussion, and we hope that you use the chat in Pathable to raise your questions or comments. But before we start with the session, I would like to share with you some practical recommendations. First, arrange the split screen or set up 2 monitors. You will need to see the Zoom window. You should be able to see this presentation, as well as the chat function in Pathable. Please start sharing your questions, ideas, reflections through the chat in Pathable, and we will filter them to the moderator of the session during the plenary session. The webinar will be recorded. Please keep yourself muted in the main session and introduce yourself if you want with the name, organization, and country in the chat box. Put your questions in the Pathable chat box and share good case studies if you want on service delivery models and respond to the 3 polls on Pathable. Next slide, please. Yes, allow me to introduce you to the speakers today. I will start with Julia, who is a water and sanitation specialist and co-director of Agua Consult. She will introduce you to the framework on service delivery models and also provide a summary of key takeaways from the RWSN webinar last week. The second speaker is Ricard Ginet, who is the advisor for sustainable services at SIWI. Then we will have John Kanyama, who is a WASH officer at UNICEF Malawi, who will introduce one of the case studies. Also, we have with us today Wilford Turimaso, who is the WASH program coordinator at IRC Uganda, who will also present a case study from Uganda. And we also have Katrina Charles, who is working at Oxford University as professor of the environmental health risk and chair of the Oxford Water Network. Aida Wambui Gitu is a researcher at Johns Hopkins University in the US and is going to moderate a panel discussion with 3 panelists, Katrina Charles, that I just introduced, but also we have today with us Tamiru Gedef Awami, who works at the Water Development Commission at the Ethiopian Ministry of Water and Energy. And we will have also the presence of John Butterworth, who is the Director of Change Hub at IRC. And the closing remarks will be made by Sean Fury, who is the Rural Water Supply Network Secretariat Director. If we move to the next slide. Yes, I would like to, maybe before we start, I would like to break the ice with a poll that we have included in Pathable in the platform. I hope you can see the poll if you click polls, and we have 2 very simple questions. The first one is, are you planning to travel to Stockholm next week for the in-person World Water Week? So if you go to Pathable platform, you click the polls button, and then you should have the questions. So feel free to vote now. Okay, I see that some people is starting to vote. For the time being, we have 67% of participants responding that yes, they are going to attend in person. We have 28% no, and 6% still unsure about it. But it seems that the majority of participants here will be able to join in person. I believe that after 2 years of pandemic, there is a lot of interest on meeting in person and exchanging ideas and networking during the Water Week. Okay, so let's move to the second question. I will give a few more seconds if you haven't been able to find the button. I would like to suggest that we answer the second question in the poll, which is, did you join the previous Rural Water Supply Network webinar with the title Service Delivery Models for Rural Water Supply that was conducted on Tuesday, 28th of June, 2022? I think this second question will help us, adjust a little bit the speeches if we have a majority of people that join already the RWSN webinar. But I see for the time being that only 33% of respondents joined this RWSN webinar a couple of months ago. Of course, it's not kind of, you don't need to have joined that webinar, but that would help the presenters. All right, so I think I see 35% of respondents. So roughly we have 2/3 of participants that didn't join the RWSN webinar. I will share later the chat, the link to the index. I will share the link to that session in case you are interested. Okay, so I think I will leave the last question to the end of the session, and without further delay, I would like to pass the floor to Julia Boulenoir, who will introduce us the framework on service delivery models, and will also provide a summary of key takeaways from the RWSN webinar last week. So Julia, the floor is yours.
Thank you very much, Jorge, and good morning, everybody. My name is Julia Boulenoir, and as Jorge said, I'm a WASH consultant working at AgriConsult, and I'm also the co-lead of the Sustainable Services Thematic Group of RWSN, together with Jorge. I'm part of the US-funded Real Water program, which I'm sure some of you at least have heard of. where, amongst other aspects, we investigate the performance of various management arrangements or service delivery models specifically for rural water supply. So this is very closely linked to the topic that we're talking about today. Next slide, please. So, as we know, delivering rural water services and sanitation services is very complex. And like every public service, it's really not just about the infrastructure. In fact, one could argue that the engineering or infrastructure part of the equation has been more or less mastered and hasn't changed that much over time. What makes water and sanitation service delivery complex is that it requires a whole system to work. It requires a range of stakeholders working together at multiple levels and ensuring that the key elements are in place in order for the infrastructure to work. So it's really about the institutions, it's about the financing, it's about the coordination, the inclusive approaches within which services are provided that makes service delivery complex. It's also complex because it requires balancing competing pressures, for example, between financial viability and affordability, between service extension and service rehabilitation. It's also complex because it involves tailoring approaches to different contexts, to different populations, and what works in one place won't work in another. So all of this to say that this is all part of service delivery. This is all to be considered when thinking about service delivery models. And ultimately, it's very political. It's a political process, a complex process, and explains why we still have millions left behind, essentially, particularly in rural areas. Next slide, please. And you can click through the slides. So the recognition of this complexity has actually taken quite a lot of time. And this has been mirrored in the ways in which services have been managed on a daily basis. And here I'm going to focus on rural water supply rather than water and sanitation, but I think the same is largely true for sanitation. And what we see over time is we can identify a clear sequencing in the approaches taken to rural water service management. So before the 80s, approaches were very centralized, largely top-down, focused on hardware, and it did lead to some progress in extending coverage, but also to lots of limitations, particularly for maintenance. So from the 1980s, community-based management was introduced. This was done as part of the UN Drinking Water Decade, and it was driven by the will to introduce greater participation, ownership, but also to account for some degree of abdication of core responsibilities from government. And this model, the CBM model, was then generalized in the 1990s to become essentially the predominant model across most countries. Then in the years 2000, the limits of CBM started to be evidenced, and this was expressed in different ways through high non-functionality rates, through poor levels of services that were starting to emerge, and voices started to raise the need to provide more systematic support to communities, accounting for the fact that we were in a context of growing decentralization, low capacitated local government, and that communities couldn't just manage on their own from a technical perspective, as well as a financial perspective. And finally, we see a trend emerging over the last decade where alternatives to basic community-based management have emerged, but also are expanding. And this has been driven by what I just said, the acknowledgement that basic forms of CBM just didn't work, but also the context of rising expectations from rural populations, higher government ambitions, and also the complexification of rural water systems. And this has taken different forms. We see in some countries efforts to support CBM more systematically, so keeping CBM as the predominant model, but supporting it either through government. So this is the case in Peru, for example, where a lot of effort is put into developing rural water-specific regulation. It's also done through the adoption of other models, such as public utility provision. That's the case in Ghana, for example, with the Community Water Supply Agency. It's also done through the generalization of private sector participation. That's the case in Rwanda or Senegal. And finally, related to that is another trend of consolidating services to increase the size of the service provision area. And that's done in the spirit of increasing financial viability and in turn increasing service quality. So this is broadly the trajectory we're seeing in many, many countries. Next slide, please. Yeah, we know that populations are not monolithic, that they vary in size, density, but also expectations. And for that reason, we know that multiple approaches to management are needed and will continue to be needed in future. There are various typologies of management arrangements that exist out there, and they have differences. Their main differences is that they present different variants of arrangements, but they all recognize 4 broad categories of management arrangements, and I'll quickly go through them. The first one is self-supply, where households essentially construct and maintain their services, and that's dominant in highly dispersed areas, as well as where services are essentially very limited. The second broad category is community-based management, which I spoke about before, which remains the dominant model. And in this case, communities just take on operation and maintenance, with more or less support, either from a public body, so local government in many cases, or through the outsourcing of core functions to the private sector. The third big category is private sector provision, and within that we see 2 main variants, where private operators own assets and operate them on a daily basis, or when assets are still owned by a public body and the private sector only operates them through a delegated contract. And the fourth category is public service provision, where governments provide services either directly through local government or through a public utility. Next slide, please. So what I've described before is a very broad trajectory of travel, which we're seeing in many countries. And obviously there are variations. So I just want to refer back to the webinar that Jorge mentioned in the introduction that happened late June, where we saw this trajectory in practice illustrated in Ghana and Senegal. And I just want to share maybe 4 key points that I took away from the presentations we heard then. The first point was that, yes, Ghana and Senegal went broadly through the same trajectory, and that they're now working on generalizing alternatives to community-based management. But firstly, these changes were introduced to account for what I said before, the complexification of services, rising expectations, limitations of CBM. They were introduced over a relatively long period of time, but I would say following different approaches. In Ghana, it was very iterative. Different things were tried, trialed and tested, and now there's a clearer way forward, whereas in Senegal, there was a very clear plan from the start and deliberate strategy to implement that plan. The third point I want to make is that Ghana and Senegal adopted different strategies. Ghana recognizes the diversity of approaches that are needed to manage rural water services in different contexts in a country that's rapidly urbanizing, whereas in Senegal, the choice of pursuing one model has been made, and that model is private sector provision. And finally, regardless of the arrangement, countries are facing common challenges, and that's something that has come up in the discussion also of the 27th of June, is the issues of regulation and financing particularly come up regardless of the arrangement in place. Next slide, please. And I think this illustrates the fact that when we talk about service delivery models, we really need to keep in mind that we're not talking about a service provider only. We're talking about a service provider operating within a broader arrangement that is itself operating within a broader water system. And a lot of stakeholders influence this. A lot of elements of the enabling environment are required to be in place for any arrangement to work. Next slide, please. Yeah, so as part of Real Water that I mentioned before, we're looking precisely at that. We're looking at the performance of different arrangements in different contexts. We're also looking at the factors that actually influence the performance of these arrangements. And I just want to take this opportunity to thank people who've responded to the e-survey that we rolled out in June, July. We had over 400 respondents to this survey. And this really emphasized the fact that we don't know much about performance of management arrangements, but we know that it's influenced by a large range of factors. And this all goes to confirm the fact that when we talk about service delivery, let's just keep a very broad perspective, systems perspective, holistic perspective on it, and not limit it to a service provider type. So with that, I would like to now hand over to Ricard Gine from SIWI, who is going to introduce the case studies. Thank you very much.
Thanks a lot, Julia, for this inspiring session, for this inspiring presentation, and also for sharing with us the key findings and lessons learned from the first webinar. Now, as Jorge has mentioned, the idea is to present 3 case studies. They all propose specific solutions that have been implemented to promote the effective implementation of service delivery models in different settings and from different sectors. So just before we start, 2 key messages. There will be no question and answer session after the presentation of the case studies, but we do have representatives of all these 3 case studies in the session. So please, if you do have any comment, feedback, question, please direct them in the chat, and surely colleagues from the case studies will be able to address them. And the second message is that, of course, I mean, we will present 3 inspiring, I hope, case studies, but we know that there are many good practices around. So it's also good if, or we would like to invite all participants to share good practices, good stories that they know in the chat, so that we can follow up and they, of course, can inspire other participants. So with no further delays, let's move to the first case study, which is presented by our colleague, John Kanyama from UNICEF Malawi. It's an urban service delivery model that has been implemented for sanitation in Lilongwe, the capital city of Malawi. This case study was developed through a partnership between UNICEF and the World Bank, and it shows the benefit of delivering different levels of service to different categories of users, which basically has turned out essential to establish cost-effective service chains and also cost recovery strategies. So let's go to the first case study.
Everyone, my name is John Kanyama, working with UNICEF Malawi Country Office. This is a short case study around sanitation service delivery models, which we are developing in Malawi as part of our financing work to improve the enabling environment around urban sanitation. As seen from this chart, the urban sanitation sector in Malawi is similar to many other cities in the region, with unclear institutional arrangements, limited oversight guidelines and financing, poor infrastructure, as well as high proportion of unimproved latrines. Therefore, in order to attract more resources and financing, there are a number of risks that need to be mitigated through the establishment of a clear service delivery models based on sound business plans and cost recovery strategies. Now, UNICEF and the World Bank, through a blended financing arrangement, have partnered to support the development of a sound service delivery model for fecal sludge management in Lilongwe, and currently also expanding to Blantyre, to support service providers and asset owners who are the city councils to roll out proper sanitation services. The model is based on a hybrid approach where services are delegated to private operators through leasing and permitting arrangements, as illustrated in this chart. This provides chance for large companies to operate with own equipment, removes burden for initial capex from small companies, which allows for competition between firms, thereby improving service quality. The service model is also based on a circular economy principle, as it foresees recycling and reuse of treated products and the engagement of women cooperatives for business development. And the concept behind this approach is to foster a competitive market around fecal sludge management. And through this model, the City Council will generate resources through licenses, leases, permits, and dumping fees, and will provide appropriate subsidies to low-income users. Finally, as seen from the chart, the city councils also provide training, demand generation, and periodic evaluation of the services in order to maintain service quality. Now, this slide provides some key features of the Malawi service delivery model aimed at supporting decentralized proper approach with robust cost recovery strategy with well-defined tariffs. All these factors helping in further de-risking the sector to attract more repairable financing. So under this model, there is a central sewage treatment plant, which is owned and managed by the city councils. Fecal sludge from on-site sanitation facilities is also currently being treated within the system. Currently, before we construct new fecal sludge treatment plants in selected areas of the city. The model also integrates community-based financing related to sanitation marketing to boost construction of improved sanitation, household latrines. And in this model, the water boards and city councils have both service authority functions as well as service provider functions. And tariff setting is proposed by the water boards and city councils and approved by government. And finally, the water boards do set standards and regulate provision of services. Now, finally, the accountability triangle shown here tries to showcase the roles and relationships of various stakeholders in the urban sanitation subsector. As seen from the chart, the national government, through the Ministry of Water and Sanitation, sets national policy, infrastructure investments, delegates responsibilities to water boards and city council in line with the relevant laws. They also receive periodic progress reports in line with the services provided. Whereas the water boards and city councils do set relevant standards and guidelines, provide services, and also delegates other service provision functions, trains and undertake demand generation interventions, and have quality assurance functions. They also provide periodic reports to the central government as well of enhancing accountability. Whilst UNICEF and other NGOs do support sanitation business planning, training, sanitation revolving fund, demand generation for services, and are accountable to the local authorities. The private sector are responsible for service delivery around sanitation service chain, and also do take part in demand generation for the services they're providing. They report back to the water boards and city councils. Whereas the SACCOs, who are the service and credit institutions, do manage loan disbursements as well as recovery and do undertake demand generation and report back to the NGOs. And finally, users who are households, these are just requested to form groups, access the smart loans, procure the various sanitation products and services, and repay the smart loans accordingly. So in short, this is the end of my presentation on sanitation service delivery model. And thank you very much for giving us an opportunity to share the Malawi case study. Over to you, the organizers.
Thank you, John, for this inspiring case study. Yeah, if there's any, of course, comment to this case study, you can write them in the chat, and I'm sure John will be able to provide you feedback. So the next case study is presented by our colleague Wilbrod Turimaso from IRC Uganda. It shows how services have been extended in rural areas through a partnership between the national water utility, the district government, and the NGO, and how this partnership has forked and has leveraged finances, extending these water services into areas that were not covered by any other service delivery model. So let's go for the next video.
I want to talk about a case of water supply extending in the rural areas using the utility model, which is a case that we have in Kabarole, one of the districts in Uganda. And in this case, what is interesting about it is that as we developed the Kabarole master plan, WASH master plan, way back in 2017-18, the study revealed that Kabende sub-county had very low coverage figures of around 35%, and it was difficult to supply them with most of the technologies that were available. So we devised a way of working with our national utility, the National Water and Sewage Corporation, and we have currently increased. The service level right now is approaching 68–70%. And that's something that I want to highlight, how we succeeded to do this with an investment of around $86,000 so far. Our target is to see that we cover it 100%, probably within the next 1 or 2 years, we should be covering them 100%. So when we discovered that the coverage figures were very low and there were no other possible ways of supplying them with water, it was not possible to get the boreholes to drill down. They were constantly getting dry wells. Then the other open water sources were way down in the valley, and it was difficult to use them because they would need a lot of costs, development, and even operation. So the only option we have was to really get a piped water system. And the nearest was the national water supply points. So we leverage on the fact that the national water over the recent few years has gone towards what you can call semi-rural, basically the rural urban areas. They moved from 25 main towns in the country, and they have reached around over 200 smaller urban centers, but they have not been going to the real rural areas. But using that, we thought that it would be possible to get them interested in extending to these areas. But we didn't have a framework of working with them. Our MOU is with the Kabarole District Local Government. We didn't have an MOU with National Water. So what we interested the district to do was to develop an MOU with the National Water and Sewage Corporation So they made an MOU, and based on our MOU with the district and the MOU of the district with National Water, we agreed to work together on Kabende. And we had some resources. The district was willing to put in some resources, and National Water was willing to support mostly with their technical expertise. They are ready to support the procurement of the people who are going to do the work, which is what they did. And we faced the work in different phases because we didn't have money to do it all at once. So we did the first phase, and then we did the second phase, which we just completed this last year, 2021. And this year, we are now planning another phase with them, which we should do before the end of the year. And yeah, mostly we provided the resources. The district also put in resources, and the National Water procured the people who did procured the materials, but also got the people who did the trenching and the laying of pipes and all of that. They provided the technical supervision because they have the engineers, and we also basically did monitoring. And that way, we were able to do something which probably none of us would do individually with the resources that we had at the individual level. And I think it is something that really can be interesting. If it can be scaled up, there is much more that can be done, probably with other districts and in other areas which have similar challenges like Kabende had. One of the challenges, of course, that we've been having, especially with the rural water supply systems in the country, is the operation and maintenance of systems, because they have been majorly under community-based management system, which has shown over time that it is not really going to provide the professional expertise that would really manage a scheme like this. So one of the benefits that we can say we got out of this is that we already brought a utilities company that has already a lot of experience in the management of piped water systems. And so, even before constructing this system, we were very sure that it's going to be very well managed, because now National Water, after constructing it, takes over the management of the lines. We have in total put close to 10,000 meters, that's 10 kilometers of line, of piped line. And they take over, whichever section is finished, they take it over for management under their utility management model. So we don't have any worries that we are going to have challenges in the management, or because we have a very robust and well-prepared utility company that takes over the management.
Thank you very much, Wilbrod, for this nice case study. And let's move to the last case study, which is presented by Professor Katrina Charles from Oxford University. This last video shows a service delivery model for drinking water in Bangladesh. And basically it was developed through a partnership between the academia with partners from the local government and NGOs. The idea, or the main idea of this case study, is how to incorporate drinking water safety from the very beginning of the service delivery model. And basically it allows to reduce health risk to consumers, particularly school children and patients from healthcare facilities. I hope you will enjoy this last video.
Hi, it's great to be part of this session today talking about service delivery models. I wanted to share a case study on embedding water safety in service delivery models. And this comes from some work we've been doing in Bangladesh as part of the REACH program, which is funded by the Foreign Commonwealth and Development Office. And it's called the Safe Pani program. The Safe PANI program is looking at providing professionalised service delivery for drinking water services based on a geographic approach of trying to provide those safe services for all schools and healthcare facilities in particular within a local government area, and this as well as some strategic public sources. And so as part of this, we're not looking just at providing access. Bangladesh already has great access to improved water systems, but we're also looking at ensuring that the quality of those water systems is safe, which is a much bigger challenge in Bangladesh. The area where we're working is in the southwest of the country. So for those of you who aren't familiar with it, this is an area where salinity is a really big challenge because of and particularly related to storm surges and cyclones as well. In the map here, the green areas of the pie charts are areas where there is access to groundwater that isn't too saline generally, because there are a lot of use of deep tube wells and shallow tube wells. The area we're working in some of these areas where there's more red and blue. So these are areas where people have to rely more on pond sand filters and surface water sources because of some of those salinity issues. And so this is the area Kulna in which we're working. With the Safe PANI model, we're working with a range of institutions to deliver this new service delivery model. And so this includes UNICEF and the government of Bangladesh, as well as other ministries. The Department of Public Health and Engineering, which of course works to provide safe water in Bangladesh, and also then the ministries of the places where we're working, so Department of Primary Education, Department of Secondary Education, Ministry of Secondary Education, because these are of course important stakeholders who need to be part of these decision makings and who also have responsibilities for safe water provision in these areas as well, and the maintenance and ongoing care for these systems. We're working in 4 unions initially. As you can see across the map, there are different types of water systems depending on those challenges of groundwater salinity in the different areas. So Bajua is an area where we've got lots of rainwater harvesting systems, but further north we've got more reliance on deep tube wells. And additionally, we've got other systems in there. So there are some sites which are still using shallow tube wells. There are pipe systems, reverse osmosis, solar water desalination units, and a managed aquifer recharge as well. And so the approach isn't then reliant on one system, but it is capturing multiple system types and more focused on where they are, which is at schools and healthcare facilities. Overall, that gives us 65 primary schools and 15 secondary schools, and that is benefiting over 8,000 students and patients who are using those sites. So the design of the service delivery model then, for considering water safety, firstly we're working with existing systems, so we're not creating new ones, but we need to work with the existing water quality challenges in these systems. And we've embedded water safety from the start, because we know that if we've got a system where if we come in and do the operation and maintenance side of our service delivery model first, working on those relationships with the government, with the NGO and with the users, then we'll have to renegotiate all those relationships to bring water safety in later. So we've made sure it's right in there from the start, and we've embedded it through a water safety planning approach. So a risk-based approach to really looking at what are the biggest risks, how do we address them, how do we minimize risk to people who are using these systems. And so there are 2 parts to this. The first is the water quality monitoring and response. So this is linked to the operation and maintenance side of the work, the regular part. And it includes sanitary inspections, as well as monitoring for E. coli, but also looking at arsenic, manganese, and salinity as well. So that routine monitoring gives us information on if that system, of course, is working properly, but also then helps to inform our response. So if there's a E. coli detected, the team at Highsour are going out and doing shock chlorination straight away to make sure there's an immediate response, and also notifying the users. But also with their work on maintenance and repairs, they're using the information from the sanitary inspection to inform improvements. And that photo in the middle is an example of a tube well with a plinth that was inadequate according to the sanitary inspection. And so they've raised that and improved it. And they've also made sure it's now raised above the flood level. So there's also adding in climate resilience to this. The second part though, while these are addressing some of the acute needs, there's also more chronic and long-term needs in terms of water quality and water safety planning. And so this is where the strategic planning comes in for that continuous improvement and building resilience. So here we're helping to inform those longer-term decisions about replacement of systems or upgrading new systems, and where treatment is needed. And that can either be sites where there's multiple hazards, so one treatment's going to be quite complex, and so these are sites where we might have arsenic and salinity and pathogens as well. Or we can also help inform where, if there's deep groundwater perhaps that isn't saline, where there might be an opportunity to improve the delivery through exploiting that groundwater resource and creating a system that's going to help more people to access water. So thanks very much. I look forward to our discussions later in the session.
All right, thank you so much for those 3 case studies. I hope we've all really enjoyed them and learned from them, and looking also forward to people sharing additional case studies of good things they're doing in the field. My name is Aida Githu, and I'll be moderating our panel discussion, which comes soon after this presentations, and hopefully we'll be trying to pull out some more meat with our panelists. So our panelists are Tamiru, as had been introduced, from the Ministry of Water and Energy in Ethiopia. We have John Butterworth from IRC, and we also have Katrina Charles, who we've just listened to now, who's a professor at University of Oxford. So I'm a bit concerned of my time, so I'll go straight into the discussions and the questions, and looking forward also to the audience. Hopefully you can participate. We have a poll running at the moment, and my intention is to come back to it with the concluding remarks. So if you've not seen it, there's a poll. The third question there was, which areas do you think require more attention and support to promote effective implementation of SDMs? So please fill that poll based on what we've seen so far, and with how the panel discussions go. So straight into it, I think I want to pose my first question to Tamiru. And this question is phrased out of the Malawi case study that we've seen. And John introduced this case study by framing the enabling environment and mentioning that, there are a couple of challenges that they've seen in Malawi, but these are not unique to Malawi. And he was talking about, the enabling environment having challenges. He highlighted issues of unclear institutional arrangements and limited oversight guidelines and enforcement. And so to you, Tamiru, I think the question I want to say is, I think the enabling environment for effective implementation of service delivery models is generally lacking, especially at the local level. And I'd be curious to hear whether you agree with that, and what your thoughts are on how we should move that forward.
Okay, thank you very much. I think I agree with it in general. The challenge is in most of our development plan, especially in water sector, the attention is for the infrastructure development. In most of our previous projects, especially the WASH program, in 10 years ago, mostly concentrated on the infrastructure development. But the post-construction, the self-delivery, including for water supply, sanitation, and the hygiene is lacking. But nowadays, most of our programs include this post-construction as a part of the programs. So the challenge is there, but there is some improvement in this area in Ethiopian experience. You see, there is a new policy under revision, which also has a statement, especially on the service delivery, how to make efficient self-delivery in both a rural area, in urban area. There is also ongoing rural management system guidelines, which also support this. But especially on the sanitation component, fecal management, we are also in challenge. So maybe my recommendation is there are different service models for urban and rural areas identified by the researchers. So I think it is time to start practicing where it fits. Of course, we cannot say it fits for everywhere in the country. It is based on the mode of service, like on-site, networked, and also in urban area, maybe the mode of service may be different. So that is my my point, but I agree with the challenges.
All right, thank you so much. And I like one of the things that you highlight on, which I think goes to my second question that I want to pose to John. And you've talked about the need to work with other entities, and you're talking about fecal sludge management and seeing approaches that are identified by researchers and applying them appropriately. And going back also to the case that we saw in Uganda IRC, which I think is a very, very interesting case. It was lovely listening to that on how IRC has been working with the district level entities, but also the national utility. And so I think, John, I want to hear your thoughts on the statement that it's important to strengthen collaboration mechanisms among different actors, managing different service modalities in the local context. To what extent, do you, I think generally we would agree with this, but I want to hear you flesh that statement out to see how it looks like.
Thanks very much, Ida. Yeah, well, I mean, if you know IRC, we like to think very much in the way that Julia was describing at the beginning when she was talking about, the need for systems approaches in order to deal with some of this complexity in a manageable way and address the challenges she mentioned at the beginning. And I think that is what we do with service delivery models. Actually, it's a way of looking at part of the system. We put a boundary around something, and that makes a lot of sense. So it makes a lot of sense to focus, let's say, on utility managed systems, and we might integrate some functions there within a country vertically around that specific issue. We may do the same with fecal sludge management, or even supporting community-based management or self-supply. So we think about the service delivery model, and we think about how to deal with some of that complexity that was being mentioned in the cases, like particularly from Malawi. There was a nice list there of all the different things you need to look at to get that service delivery model working. And while that obviously makes sense, there is one big challenge there, that if we mainly think within these system boundaries of those service delivery models, we might forget about how the different pieces of that jigsaw fit together. Because I think it's like a jigsaw. You might get, you put some different service delivery models together, and that adds up to the full provision you have. And if we sometimes forget about how they fit together, we miss some opportunities, and we're very likely to fail to meet the target that people have. Everyone has access to at least one service delivery model for water and at least one for sanitation that will meet their needs. So I think thinking about how you put those together is important. And we sometimes do that when we plan, e.g. at a district level or at some other kind of scale. But we can do it in other ways too, by promoting coordination between service providers and service authorities, and thinking about how different service delivery models fit together. Because there are some really key choices to make. You can't extend all these service delivery models to everybody. So you may have to decide one way or the other, like we heard in the case from Uganda. In this case, it looks like the right way to go is extending a utility service. But those kind of decisions need to be made all the time within some kind of local framework.
Thank you. I think I'll come back to you on that, hopefully later, allowing time. But I want to connect that and what you've said to a question to Katrina. And Katrina, I think the case we've seen from Bangladesh is significantly different, or not significantly different, but comes from a different angle, which is looking at water quality. But to John's statement, and how I want to tie this to the question to Katrina is, you talk about the need to identify different parts of the jigsaw and how they fit together. And you've also mentioned that some of the ways to do that is through planning, through promoting coordination and such. And so it was interesting listening to the case from Bangladesh. And one of the things that really caught my ear, Katrina, was when you're talking about the design of the system, you mentioned that you, one, work with existing systems, but you also mentioned that you embed water safety plans from the start. And a curious statement that I had there was you made a statement to the effect that if you work on O&M first, then we need to go back and renegotiate with governments to incorporate water safety planning, which I thought was a very interesting way to frame it. So is that to say that should or should not SDM models focus on O&M first? And are you making the argument that you can't do water quality until you have water, or is it the flip of that? Over to you, Katrina.
Thanks very much, Ida. So thanks for that question. I think often when we're talking about these models, we leave water safety as implicit, and it's a big part of the Sustainable Development Goals is trying to move towards safe water for all. And so some of the places we're talking about in the rural water safety, rural water supplies are very challenging, and we've heard about different contexts, and we've heard about some of those challenges. And it's as John has highlighted too, it's a complex system that you're working in and that you're needing to change to make that service delivery model work. So if we go in there and we're not being explicit about water safety, then there's a chance we overlook it. And I think that's something that we've been doing quite often, is that we often end up with it being implicit that it's okay to provide people with water that's contaminated with pathogens, arsenic or salinity. Not that we mean to, but just that we're not taking the time to make sure the approach is making sure that water is safe. And there's a number of reasons that we have barriers, or a number of barriers in place to people's thinking that is limiting the uptake of these water safety approaches. And I think some of that is sometimes we assume it's too expensive, that we can't do this, but it does, which doesn't quite meet with the human rights approach to really think about safe water for all. And then the other side then is also that the assumption that we're addressing drinking water safety through improved systems. I think there's a lot of evidence now that shows that improved water facilities, while they do better, but they're not good enough without management. So we need to make sure we're addressing water quality, but it does come back to the issue of, do we have the capacity? And so we did a survey with Rural Water Supply Network last year of service providers internationally for drinking water. And that was both government and non-government. And that was about over 350 service providers. And so there's a lot of different service delivery models going on using these professional and government service providers in rural areas. And what we found was that it's actually very common for professional service providers to be using to be considering water quality. So almost all of them reported using at least one type of water safety activity. 2/3 of them were reported undertaking regular monitoring. So there's information there on the water quality and on the risks. But only 31% of them, a third, reported doing really what we'd consider the water safety package. So water point monitoring, source protection, treatment, and reporting monitoring results to people who need to have that data. So users, operators, managers, and so forth. So we have service providers who are including drinking water safety in their activities. And it's being implemented, and it's about how we strengthen it. And so our research that we've done in Kenya as well shows how complex it is to bring in water safety to an existing service delivery model relationship. Because when you create that relationship, you also, you're creating that relationship between the government and the service provider, between the service provider and the users. And it is a complex system that is being created. So if you're just doing operation and maintenance, those relationships have been negotiated. If you then try to bring in water quality, you're changing all those relationships again. So while, and then you need to have new relationships, for example, with government labs, hydrogeologists, chemists, microbiologists, and again with the users to bring in more water quality information. So while I totally agree that water reliability and quantity is essential, bringing in that quality and safety aspects from the start is the best way forward to have those relationships in place that you can build them from the start and build towards safe water for all.
Thank you. I think that's a really interesting perspective because I will have to admit from my my thinking or my just biased perspective, not thinking too much about it. I'd say let's first have water and then deal with these bigger issues. But that makes absolute sense, and I think it's something I've not considered previously. So it's very interesting to hear that perspective. I also do really like how you emphasize on the need to work with governments. And I think even with your case study, you highlighted the way you're engaged with different ministries. So there was education, there was health, etc. And I'm curious whether beyond, or really, if we could flesh this question out, and maybe I'll ask Tamiru first to talk to this, and then if Katrina has something to add on this importance of collaborating with government and ensuring that we have partnerships with government from the word go is essential to having successful SDMs. What do you have to say to that, Tamiru?
Yeah, thank you. I think as we are doing, especially on the infrastructure with development partners, including the civil societies, I think this service delivery, which is partly a management issue, collaboration with the development partners is very essential. Currently, we have experience working with different development partners like the British Embassy and also UNICEF in this area in formulating and also in producing of management guidelines for water supply and sanitation, especially for rural part, and also fecal sludge management for urban component. So we are currently working with development partners. But my point is, as currently most of our service model is public enterprises, especially in urban areas, the utilities. In the rural area, mostly they are water committees or wash committees. But currently, because of the mode of service, especially from on-site water supply mode, we are currently go to the multi village, like multi-district water supply systems in rural area. The yes, rural water utility is a must, but I think at this level, mostly from the private sector, if supporting on operation the maintenance and supply chain, especially on providing, we are working with this also with different donors to establish supply chain through the urban utility or through the private sector. So I think the harmonizing, bringing the experience of different countries and the fit to the country context is very important. Thank you.
All right, thank you so much. And I also want to go back to Katrina on the same question, but there's a question from the chat where someone is asking, so they say, thanks, Katrina Charles. How different is it, what you have done in the project from what government service delivery mechanism is doing? What could be the driver of the government to adopt that, especially in areas where water scarcity is the key concern and not quality? So if you could please respond to that.
Yep, thanks for that question. I think this is a, I would certainly agree with Tamaru that it's very context specific. And so it is, and it does vary. So certainly in the Ethiopia context, they have huge differences between different geographies, different climates, that will make big differences to how you would implement the service delivery model, as Tamaru's highlighted. And also, of course, the difference between water and sanitation. I think that's one where it's difficult sometimes to talk about water scarcity more broadly in the areas we're looking at. There is a type of water scarcity because of the high salinity of the water, but there is not the absolute water scarcity that we will see in other contexts, certainly as Ethiopia has experiences with. But I think the differences from the government service delivery mechanism in terms of what we're doing is shifting from, so particularly a focus on schools, for example, that the service delivery mechanism is split within different government departments between implementation, operation, and maintenance. And so water safety almost doesn't exist within that as well. Or that it's their implementation, but not in terms of management. So in schools, you end up with the schools doing maintenance, and that means that within their budget, you've got them competing. Their operation and maintenance budget for water is the same as the operation and maintenance budget for the rest of the school. So they've got to make decisions at a school level about how that happens. So bringing in a professional service delivery provider helps them to have access to the information they need, access to the skills that they need to implement that. And so it's shifting that way. We're very much working with the government so that it's not just leaving that responsibility to the individual schools, but helping them to make some decisions about how their funding is being spent. So I think in terms of drivers for government to adopt that, that's still something that we're demonstrating through this model, is very much trying to find the evidence to demonstrate how this supports the government so that they will adopt it more broadly. And one of the things I want to make on your previous point, Ida, too, while I'm mentioning this, I think in Bangladesh with Safe Pani, we work very closely with ministries and been able to address these gaps in the way, in the enabling environment, particularly, for example, schools and healthcare facilities. But I don't think that's just one way of working. So I've mentioned the context in terms of geography and climate, and that's a big issue. But there's also a lot of context important in that political environment. So we've also worked with service delivery models that are not led by government in the same way. There's still partnerships with government, but it's a very different level of relationship with government in how they're implemented. And we've seen those also being effective. So I think there's lots of different ways in which we can make service delivery models work. We can make them sustainable. And it's trying to make sure that we're sharing information like we are today so that people can see these different opportunities.
Great, thank you so much, Katrina. And I think that makes a lot of sense. I want to piggyback on something you've said to pose my last question, which is to John. And you've mentioned on how with Safe Pani you're hoping to demonstrate to government on the effectiveness of this, and they can apply it more broadly. And I think, to John, I wanted to hear your perspective also. It was very interesting seeing, the kind of MOUs in Uganda between IRC and the district and the national utility, and all of you working together. And the question I have in mind then is that the issue of scale, whether it's at national level or at sub-national level, becomes of utmost importance. And basically, we find that typically local areas have not received the adequate attention they need. So John, how do you think we can support local actors in this end, towards this end?
Yeah, maybe just two things, sort of like an ending message. Yeah, I think it's about scale. And I think that's about what I said before, also about putting service delivery models together. Unless you do that, we don't have enough scale. We're not getting close to reaching everybody. But if we do put together higher service models that we saw in the framework Julia presented, with other models that are perhaps not providing as high levels of service we need, ultimately, particularly through community-based management, but look at how we improve self-supply as well and get that safely managed. When you put those things together, you get much closer to scale than if you work separately. So I think that's really important. And the other thing that I think is really important through these kind of meetings and wherever else we have opportunities is sort of understanding and looking more at how this is very, very dynamic. We're trying to evolve service delivery models in places really, really quickly. And we don't always have time to think about what that means. And I know your own PhD research was on this, Ida, and I think that's a particularly important area for lots of people to look into. It's in some places, it's about how we evolve the capacities in these service delivery models. How do you turn self-supply into community management and that into a utility, or at least some aspects of the capacities, rather than just trying to drop these models in and grow them everywhere. I think we need to look at that a bit more.
Thank you, John, and thanks for that personal plug. I do agree that we need to pay more attention to time and be conscious of that even as we design intervention. So to close our panel, I'll pose two quick questions to you that I hope you answer in under a minute each. And the first one is, could you identify three things, just words, like 3 words that you would say are the greatest challenges in supporting effective implementation of SDMs? And then with that, what do you think should be the role of government, NGOs, or academia, whichever you choose to speak to? You can speak to all 3, 1 or 2 of them, in supporting effective implementation of SDMs. And we can go with John, Katrina, and then Tamiru.
Okay, so my 3 words, I think it's say financial viability and subsidy, in the sense that financial viability of all of these models is really a key issue. And the risk is not putting subsidy in the right place for these to grow and for us to get the best possible combination of service delivery models we have to serve the most people. And what should the role be of NGOs? Well, we're not in a lead role, so I think supporting is the key word, right? It will always be service providers, service authorities who are in the lead role. But I think what NGOs can do usefully is some of the areas of innovation in these service delivery models we're seeing are strongly supported in NGOs, and also supporting the accountability type arrangements in these models. They nearly all depend on some kind of strengthening of accountability.
Thank you, Katrina.
Okay, my 3 words would be complexity, evidence, and funding. So firstly, the complexity of these systems, as we've described today, of how you bring all these different issues together. The evidence, how do we get the evidence to underpin our decisions to improve these, to expand these, to make these work for everyone? And then funding, how do we get the funding? Partly, rather than focusing on the finance, which John has already done, but the funding for building that evidence base as well, of really integrating the research into the implementation. And I think in terms of the roles, role for research. So not just academia, but also, our colleagues at Real Water include consultants as well, and certainly IRC's research as well. But that research for the role of research, partly as John's highlighted, is about supporting innovation to provide that evidence on what works. So I think there's a lot of questions on STMs where we have bits of information, but not comprehensive. So questions like, how much does each service delivery model cost under different conditions? What revisions are needed to laws and policy that restrict STMs? How can we regulate STMs in different contexts? Or what performance metrics, as Julia highlighted at the beginning, what performance metrics can we use for results-based funding, for example? These are all sorts of things where that relationship with research can help to support implementation of STMs.
Makes sense. Thank you so much. Tamiru?
Yeah, thank you. I think maybe the three challenges. I think one is the information. The information is one of the challenge, and also the regulation. In our case, for example, especially in urban service provision, as a country, we don't have a regulatory organ. So I think for service delivery regulation, a regulatory organ is a very important who make check and the balance in service provision. And also, as my colleague said, the resource, especially the finance, is also one of the challenge. So for this, the role of the government, I think for every country, especially in Africa, I think establishing sustainable regulatory systems and also enabling environment, just not only for the government enterprise, but for also for the future, for the private involvement in this area is very important. So for this, legal framework is very important. And also information flow, management information system. The government should know what is going on in the utility, in the enterprises, if it's managed by private. So the flow of information is also very important. Of course, the finance issue, including the for the capacity building, for soft component and also for hard component, because as the supply chain is there. Without a sustainable supply chain, service delivery is not possible in my thinking. Thank you.
All right, thank you so much. And thank you, my panelists. Thank you, Tamiru. Thank you, Katrina. And thank you, John, for all your insights. I hope everyone has enjoyed this as much as I have. It's interesting as I wrap up to notice that all three panelists identified finance or issues concerning finance, which is also one of the main things that show up in our poll. The other thing that as an audience, we highlighted a lot were issues of accountability, issues of capacity, issues of development. And to tie it back to what Julia said when she was introducing, she said that financing and regulation come up in a lot of their service, regardless of the service model that is in question. And so I think we all recognize the importance of these things, the complexity of the issues we're dealing with. And my hope is with this session, you've gotten a bit more information on how to go forward. So thank you so much, everyone. I'll hand it over to Sean, who will give us concluding remarks. Thank you.
Great, thank you, Eden. Thank you for facilitating a great discussion. There's been a lot in this session, and I've been frantically taking notes and listening and looking at what people are putting in the chat box. So to quickly wrap up, just to bring back some highlights. So Julia started us off really talking about a bit of the history, a bit of the background, particularly on rural water supply, the fact that these issues around O&M, around service delivery, are chronic problems, that this has been a challenge for not just months, but years, or it's been for decades. And that we get this from our members, from the Rural Water Supply Network, that in our member surveys, the #1 issue every time in a member survey is O&M. How do we keep our services going? That's from the day-to-day job, that's from members delivering services on the ground. So we got some ideas about maybe some pointers on how to address that in the future. Should raise the fact that there are now more alternatives emerging to community management. John from Malawi gave us a great presentation, and my takeaway from that was around, it's a lot around institutions, around very clear mandates, clear boundaries. Market players have a place and they can deliver, but they need to have, everyone needs to know where they fit, what and who's paying for what, and how risks going to be shared. So getting those the clarity of the institutions and the accountability is also really clear. From Wilbrod in Uganda, I think what's happening in Uganda is really interesting, in that you have a urban utility, National Water, that has expertise, they have engineers, they know what they're doing, and they can provide and reach out into rural areas. But then again, going back to the earlier thing around mandate, you know, when I was working in Uganda 10 years ago, and National Waters had very defined gazetted boundaries. That was their area of responsibility. Outside, not interested. Well, not so much not interested. It's just like it wasn't their job. So it's important that where there is expertise, that maybe there are opportunities. But in terms of scaling up, his last point, I think the challenge there is that can National Water itself scale up? I mean, it's one thing to help in one district, but can they really, how much burden is on them to provide technical services? But it's an interesting thing that we're hearing. From Katrina in Bangladesh, I think the water quality picture is essential, and really reminds us that the important thing is that when there's if there's water everywhere and it's all high quality, there's no problem. You can have community management, you can have private self-supply. But when there are constraints like groundwater quality, salinity, that's when you need to have the testing, and you need to have the institutions, you need to have the external support. And that's where the complexity comes in and the costs come in. And that needs to be managed. But then with Tamira from Ethiopia, again, there are his call that you know, the research, the piloting of models, you know, there's stuff emerging out there, let's do it. But context, and how does the context fit together with what's being done? And John, in terms of management models, John Butterworth emphasizing that management models, we're taking a small part of the system, and that's useful for looking at that part of the system, but there are other parts that are likely to influence that success, and context is a big part of that as well. And finally, Katrina's point around water quality often being implicit assumption that it will be dealt with, and it needs to be explicit, and there needs to be it can't just be put in the too difficult pile. So thank you again to all our speakers, all our panelists. That was a really rich discussion. And I'd like to thank all of you for attending. Please, if you want to continue the discussion, you can do so through the rest of this event, or through the RWSN Sustainable Services Forum, or from the sanitation side, please join the Susanna Forum, because this is really the issue of our time to be solved in WASH, and not just WASH, connecting WASH and water resources, please. So thank you everyone. And we will finish there, I believe.
Yes, Sean, thanks. That's the end of the session. Thank you very much.